great conversation, great participation. I thank you all so much for so many great insights and just your participation in that. I heard a lot of great things. Now the tough task is for our board members to try to synthesize some of that and give us a little brief overview of each section. While they're thinking about what they want to say, I did want to point out, I heard probably 2 or 3 different groups talking about 211 and 988. Who here knows what 211 is? Awesome. Who knows 988? Okay. So for those that don't, 211 is a online and phone resource. People can dial 211 on their phone, or they can go to runtime@211.org and they can search for tons of resources. So for Yellowstone County, we have over 1,000 different resources. You can search for housing, for mental health, for financial assistance, rent assistance, whatever it might be. So a great way to keep people connected. And then 988 is what used to be called well, it still is the same number as the suicide prevention line, but they took that and made it 988 because it's a lot easier than the old long number. So that's for a mental health crisis, suicide crisis. Doesn't have to be exactly suicide, but just some sort of mental health crisis. So 211-988, great place to refer any of your clients, any of your friends, anyone who needs help. And we're looking at hopefully doing some more marketing soon to get that word out more about it. But in the meantime, we have cards. And cards back there if you want any. And I'll just pass them around real quick too, so you all have 211 cards.
Thank you.
All right, so much stuff. I see like 5 flip charts over in that section there. That is impressive. So we're going to have each of our board members come up now and just give a little brief overview of their section. And then right after that, we'll do a prioritization activity that should be kind of fun. So section 1, outreach. Where's the outreach board members? There we go. I'll have you come up here with the microphone so we can hear you.
So our focus was on outreach, so seeking those families that are currently unsheltered. And we heard from every group that there needs to be greater coordination. Sounds like there are a lot of resources in our community, but not a commensurate awareness of those resources. And so every group, we had a little hash that we kept track of, and every group talked about the need for coordination. And I will say, don't shoot the messenger, but also within those agencies working well together, that we need to have less infighting and address the conflict so we can work together and keep the mission at the focus of our efforts. And then the other thing that I would say would be coordinated marketing. So Casey had a great example of when we see a car accident, we know immediately what to do. We call 911, and Dean did a great job of sharing 211, but does our community understand that? Maybe in this room we know, but does the general population of Yellowstone County understand the resources that we have in our community? And then the other would be addressing the outreach, would be more outreach. We currently have several organizations that are focusing on going to where the homeless are, but maybe we need more because we continue to struggle with the unhoused in Billings. And then there is a homeless management info system, HMIS. It only came up in, it was our last group, and we had already said go through 4 groups, and we're not aware, or we didn't pick up on that there's actually a system that would help coordinate the efforts and identify where the unhoused are currently, where they're connected currently, and what resources they are receiving. And then the last, I would say, is although we're seeking to find the unsheltered, but also how do we help identify those that are nearing the point of being homeless, and school districts and other educational groups like Head Start, MSU Billings, Rocky would also be good resources. What did I miss, Casey?
Ditto.
One other thing that came up, I think, was like we can do all the outreach and identifying and all that stuff all we want, but another challenge was getting people to actually take the help when appropriate. And one of our items was handout versus hand up, right? So I think there's multiple challenges here. And yeah, our group was outreach, but you can't ignore getting people to actually accept the help and then to a certain extent not become reliant on it. So yeah, thanks.
And we're done. Thank you folks, very nice job. And we don't have a lot of time with our timeline, but are there any quick questions for group 1 outreach first? Will we move on? And we're moving on. All right, group 2, who we got?
Hi, good morning. I'm Jim Irwin, one of the United Way board members, and it's not fair we don't have our cheat sheet up here. We've talked about a lot of things, just like everybody I know. Talked about what is diversion, and there's one of the groups said there's 5 different definitions of diversion depending on where you sit, and I'm sure there's a lot more than that. It's about getting people to a safe place. It's about getting families back to maybe where their home and where their support units are, whether that's in another city or another state. It's about getting people to a place that can help take care of them. So it's a lot of different things. And we talked about the different places where people end up when they're homeless, whether it's in a car or whether it's just on the street, or whether it's in a better place like a shelter, but just a laundry list of places where people do end up. And I guess in that, as we talked about how we can help, one of the discussions was around crisis centers and around the lists that we kind of work from today, where we know we've got people that need help, and expanding our ability. A lot of times there's maybe repeat people back and forth with crisis centers. How can we reach out to the people that are just kind of getting into trouble? And when we talked about that, the importance of being able to act quick and investing in things like triage programs where you can get in quick, have some flexibility with funds, and be able to make a difference. A lot of really good ideas it came out with the team, and it ranged from, there's other things like providing just those steps of assistance you need. So counseling, whether that's counseling for mental health, whether it's counseling for addiction, but then also counseling for how do I take care of a house? How do I keep a job? How do I understand this whole system, whether the system is, the world we live in, or the system is the system that you can work with to get your feet on the ground and to get to the place you need to be in. So I think we got a good list. I missed a whole bunch, but Sean can help me with that.
Just a couple of other things. We talked about some upstream prevention kind of activities too. So looking at legislation for landlords, how to help landlords with some of that risk prevention. Looking at some risk prevention for individuals. So as they identify before they lose their housing that they've missed a utility and a utility payment, what happens next? Becoming similar to Bridges Community, where we wrap services around individuals before they're actually homeless. And then the catchment area. How do we work in this region with other cities, other counties, to actually look at what diversion looks like as we're working together for families, not all landing in buildings, but helping them keep families in their community and support them. So good discussion, thank you guys.
I'm Nathan Hirsch. I'm a board member with the United Way of Yellowstone County, and I will say one thing that was unique on, we talked about shelter at Station 3 there, and one thing that came up with every single group was leveraging the existing organizations, right? Building the support between those while we work together to try to improve shelter in this community. Another thing that came up quite a few times was working with government leaders to partner together to help the unsheltered in our community. And then lastly, I would say, almost every group highlighted how there's not a one-size-fits-all answer to this, right? And that it has to be a targeted approach to different groups, especially when we think about the parameters set by the Bezos Foundation of young families, disabled folks, really working to move that objective forward. Yvonne, do you feel like there's anything I missed? No, I don't think you missed
So, good afternoon, is it good morning? I'm Terry Blevins, and I am a board member here at the United Way, and I am so excited about this project. We had a lot of great discussion in housing. Everything that's all been said was said in the housing division as well, that we need to take advantage of what's already out there. We need to connect people to resources. We need to triage. We need to not reinvent the wheel. But we had some really creative ideas, everything from mobile housing to buying a warehouse for parking for people who are living in their cars, where there could be some services for them there. We talked about, there was a lot of discussion around landlords and really educating them. What does Section 8 mean? Is that scary to them? Like helping them understand, and then providing some assurances that they will get their money. For instance, there'll be down payments, we'll pay the first and last and third month rent if you want it. Just different education programs to help landlords invest and commit to this too, and maybe an advocate to work with landlords. That was a big thing. And then a lot about housing fit, affordable housing, accessible housing, figuring out places to build that kind of housing, where they can be in communities near services, food, for instance, healthcare, childcare, transportation. So figuring out places to put that housing where people can then learn to be self-sufficient.
And then like the city codes and the zoning.
Oh yeah, so, and really looking at city codes and city zoning to make sure there aren't barriers to that kind of housing. And maybe then the last group kind of talked about a step-up program. There has to be something maybe to bring people in, and then as they become more, they learn how to take care of a house, and they learn how to budget, and they learn how to maybe get a mortgage, and then helping them move into an affordable housing and continue that and staying in that. What else, Kimberly? We can't see you're way back there. There's a lot of them.
And I wrote really small. Yeah, it kind of goes with the property and trying to build a place. I like the idea of the tiny homes with one central building inside that everyone could go to for their cooking and their cleaning and all that stuff. Not every tiny home necessarily would have plumbing and that type of thing. I like that idea.
But connecting them to a variety of services was really important to everybody in the housing. They can't just give them a house and say, okay, great, that's it. We have to really figure all that out.
Yep.
So thanks for the great discussion, all y'all.
Yes, thank you.
I'm also on the United Way board, and interesting, listen to the other groups that came before number 5. The final one is services, right? And so ours is around services, and there's such a connection between everything and all the other groups is how to make those services accessible. And a lot of great services. I mean, I've learned some new ones just myself today that are out there, but how do the people in our community know how to get them quickly? How do those who are helping provide the services be able to get that was an overarching thing? So if there was like a one-stop shopping that's easy, it's not a handoff, it's not like we'll call this number and then call this number and then call this number. But if there's a resource hub, a central hub that the community can go to, whether you're a provider or whether you're in need, that will give them the service that they need. That was overarching. And then all those services, I think there's benefits, needing transportation, needing legal services, needing health services, needing all these other services, mental health, addiction, whatever it might be. reevaluating, making sure they're getting what they need. But I think one of the overarching themes that I got out of it was, how do they get to the right service at the right time quickly? Do they need case management, need more education to those providing those services to make sure that they're in crisis mode. So what's the best way to get what they need without having to get overwhelmed even more in that situation that they're in?
Yeah, perfect.
All right, thank you, board members. That was great. We appreciate you jumping in and helping with that. We do have a few minutes for a little discussion. Of course, as you can see with everything written around here, we could have a 3-day discussion probably on this and just hit the surface. But I did want to open up to the group for first off, what were some key insights that anyone got? Just like some things that really stood out to you, maybe an aha moment, or maybe just some concept or some idea that you want to make sure continues throughout this planning process. And it is, let's yell really loud or
Now I get up here and grab I'm tired, I'm old, I can't remember.
I'll try and yell. So our group 1, we have coordination written in big old letters up there.
yeah, what?
We have coordination
Coordination.
written in big letters, right? And we got a lot of people from a lot of programs, a lot of executive directors. I'm not from your professions there. When was the last time everyone got together to have this conversation? Did it take $2.5 million to bring everyone together?
We all met here Tuesday. No, it's happening.
Was Tuesday? Okay. What's the question? Like, is it a regular thing? This is my ignorance.
There's a lot of good, there's already a lot of good coordination. I could see some of this maybe helping build on that. There's also some gaps, there's also some struggles that maybe this could help with too. But yeah, a lot of partners in this room really are dedicated and do meet quite often.
I remember, it's data.
Data.
One thing that we talked about is we need data, and it sounds like there's data out there, and then also input from the population we're trying to solve the problem for. So we may have a great list, and we all think it's great, but the needs of those who need it, I think getting that input, I think is really valuable, because they may say you should spend $2 million here or $2 million there, whoever it may be. They may not have the same ideas that we have in this room. So data, I think, would be helpful.
Data and input from persons with lived experience. Yeah, Tess.
So Dean, I want to speak on behalf of the data comment. We have a shared database currently called Homeless Management Information System, which is a shared database across the state, as well as all local service providers that provide housing services. So if you are not a part of that and you want to be, get a hold of me and we can talk. And maybe that's something we can look at as an opportunity for this funding, is that we help smaller community organizations have access to that database so we can get more data sharing across lines. It's already established, we don't need to create something else, it's already there. Any data points you all want, let me know, I have them. We have it as a community.
And let me tell you again that her name is Tess Bisok. Great resource. She leads the Coordinated Entry System program, and also looks at the Homeless Management Information System, which does help a lot with that coordination, that data sharing piece. So like Tess said, if you want to get involved with that, contact her, and she's a wealth of information too for good data and resources. Yes.
As the director of the Montana Rescue Mission, I just want to say thanks for caring about the homeless. Rescue Mission has been doing it since 1943, and I'm just thrilled that the community is getting together to say, let's talk about ways to collaborate, make a bigger impact. And maybe it sometimes does take $2.5 million to get people in the same room, but I think it's important that we recognize that this isn't just us doing it, it's the community having to do it, because it's a much larger issue than we can handle, even though our new campus will help us a lot more. But this is a great discussion, so let's keep it going.
Thank you, Matt. We've got time for, let's do a couple more right here and then back to Terry.
I want to add to the coordination, I think, because many of the homeless people that are with age or speak, I think should be contacted for their input.
So contacting people for their input that are living there, living in the streets. Right. Let's go Terry and then back here. Terry.
So I guess the one thing that I would say is not only is this fantastic, but what I would encourage is that everybody sitting in this room knows people who provide services and knows what they individually provide. And so maybe what we should do is, not to put you on the spot, Dean, but if you have somebody that you've worked with that you think is doing great work, send Dean a letter that says, I'd love these people to be part of the collaboration process. And then if your organization is planning to collaborate, say, I'm willing to do this, this, and this, and send it to Dean. So they can begin to map out what works and what doesn't, because we can sit in the room and say, well, somebody will do this and somebody will do that, but who are the somebodies? So who's willing to take which parts of the project so that they can come back with a consensus and say, this is how, one way that we can move forward.
Awesome, thank you. And thanks for volunteering me too, I appreciate it. All right, so now we get to move on to our final prioritization activity, and this is kind of fun. And the fun part is that Elizabeth put together, you'll see these $250,000 bills. So a lot of you may have done this activity where you get little stickers and you go put them by the activity that you most value. This is kind of a fun way of doing that with these little $250,000 bills. So when we say go, you're just going to go around to all the stations and you're going to put your money where your heart is. And that could be, you could put just one bill on one bill on another, you could put 2 or 3 on one if it's one you really value. The big thing is don't overthink it. Please don't overthink it. I know my mind goes to, well, I want to put 20,000 here, but that's too much, so should I split it in half and say it's only 100,000? It's really more about the priorities. You got 8 of these, how would you prioritize 1/8 of your resources?
So Dean, just to clarify, you're
Yes.
talking about the 1 through 5, not the sub-items under each
The
list.
sub-items also, yeah. So you can look
Also
at the
the
sub-items and you can put it all, you could say, I want to all go towards this one here, I think this is the valuable one, and this is the valuable one. Make sense? All right, go ahead.
Been so much more fun than putting dollar bills. It's good, actually. Yeah, I'm doing good. Things are good. They're good. See you, Jim. Yeah. Things are good. What's driving the price down? Is it the Middle East? Weird. A lot of inventory. Can't complain about that. I know. Yeah, we made a bunch of burner fuel, you know, this is very unusual. I don't know what. So, good to see you.
But it also well, humanity and like actually helping the
It would have been close. Yeah. That's the thing. It's historically purpose. Maybe I'll put a plaque.
I've done on my bed before.
No.